The plan rests on three principles: train, retain, and reform. First, training. We'll double the number of medical training places by 2031, focusing on areas where there are too few doctors today. We'll train over 24,000 more nurses and midwives a year and increase the number of GP training places by 50%. In time, this will allow us to reduce our spending on temporary agency staff by £10 billion and cut the need for international recruitment. Today, the proportion recruited from overseas is around 1 in 4. With our plan, it will fall to just 1 in 10. Second, doctors and other clinicians can spend a lifetime gaining invaluable experience. We want to hang on to those skills for as long as we can. So we'll retain more of our dedicated workforce, keeping up to 130,000 more staff in the NHS over the next 15 years. We already offer best-in-class pensions, and we've just dramatically cut the tax on pension savings, a move that has been called transformative. Now we're going to modernise the pension scheme so staff can partially retire or return to work much more easily if they wish to. And we're going to improve conditions right now for those who gave so much during the pandemic. To do that, we're improving culture, leadership and well-being, giving staff more flexibility and control, and investing in their professional development. Finally, we need reform. It's not enough just to have more doctors and nurses. We need to change the way they work so that they can deliver better care for patients. Now, partly this is about seizing the opportunities of new technologies like AI, or just look at virtual wards, which use technology to allow patients to recover at home, providing a better service at lower cost. But we're also going to expand new roles like nurse associates and physician associates so that the most qualified staff can focus on patients with the most complex needs. We're going to drive the biggest ever expansion of apprenticeships in the NHS, so that 1/5 of all clinical training will be offered through degree apprenticeships, helping to bring staff into the NHS from a much wider range of backgrounds. And will give staff in the NHS more opportunities to progress.